The Centers for Disease Control and Prevention have given the final green light to 2 COVID vaccines for children as young as 6 months old. CDC Director Rochelle Walensky endorsed the recommendation to vaccinate young children with vaccines from Moderna and Pfizer. The move expands eligibility for nearly 20 million children. Vaccines will become available for this age group starting tomorrow. So joining us now is Dr. Jerry Abraham. He's the Director of Vaccine Programs at Kendron Health. Dr. Abraham, thank you so much for being with us. So we now have 2 approved vaccines for young kids. Many parents have been waiting a long time to hear this news. What are the differences between the Pfizer and Moderna jabs?
Yes, great question. We're super excited that we've finally arrived here. We were waiting for these vaccines April, May. Now here we are in June. And now 6-month-old to 5-year-olds can finally get their vaccines and protect themselves from COVID-19. They've really been the only population that have not had this protection. Just like adults, there's a choice between Pfizer, Moderna. In some cases, people were getting Johnson & Johnson. Likewise, now you'll have a choice between Pfizer and Moderna for your 6-month to 4-year-olds, basically. And that is a great thing that really we've got 2 effective vaccines. We see this with many other childhood vaccines where there are different manufacturers making vaccines combating against the similar infectious diseases. So honestly, I say choose either Pfizer or Moderna. The studies prove that they are both efficacious. They're both effective at preventing COVID-19 illness, serious illness, and death in our youngest children. So either's fine.
Dr. Abraham, I think we'd be remiss if we didn't talk about the other choice, which is not Pfizer or Moderna, but vaccine or no vaccine. When it comes to younger kids, even that older age group, 6 to 11, less than a third are fully vaccinated. And a lot of parents looking at their younger kids and thinking, do they really need it? Am I comfortable with it? What's your advice to the skeptical mom and dad out there?
Yeah, I mean, we've come such a long way since March 2020 when the pandemic and the national emergency began. This is not really the time to let our guard down. We are moving from pandemic to endemic. We're learning to live smarter with COVID. We have all these tools in our arsenal, including now these 6-month to 4-year-old vaccines. Parents really should take advantage of this opportunity to protect their children, especially as we go into the summer months. Summer vacation, Juneteenth right now, July 4th right around the corner. We know that cases are going to continue to go up. There's still plenty we do not know about COVID, the long-term impacts of COVID-19 illness. We also don't know what mutations and variants are going to come in the future. We don't want you to wait until it's too late. Let's not wait until your kids catch COVID. Let's use these tools to prevent them from getting and spreading and getting seriously ill from COVID-19. And that's all we're trying to do here with these vaccines.
But Dr. Abraham, on that point, a lot of parents, 75% of these younger kids have already had COVID. I think Dr. Jha this morning on our morning show put it at nearly 70. I saw another study that said 75%. So a lot of parents have already seen their kids get it, and they've fortunately been able to say to themselves, that wasn't bad at all. So why get a vaccine when you've already had the thing underlying it and it wasn't too bad?
Right. I will say first and foremost, when it comes to safety and protecting our children, that's really what we're putting first and foremost as healthcare professionals, as doctors and nurses. And I know that's really the question that parents are grappling with, is how best to keep our children safe and protected. And so we hope that we all arrive at the same conclusion that getting our children vaccinated is the best way to do that. What we know from watching the FDA committee meetings and the CDC's deliberations are that the data shows that even for people that had previous COVID-19 infections, those that then got vaccinated were better off, less complications, less reinfection, definitely prevents death, which is very important. So those are serious considerations as parents move forward with making this decision. We are, here celebrating Juneteenth right now. We totally understand people have real concerns about the medicalization of racism and coercion and really being forced to do things that they don't feel comfortable with. I want people to choose to do it and make sure they have all the information they need to make the right choice for their children. I will say clearly, this is not an experiment on our children. This is not an experiment on any of us. And we've all gotten our vaccines, and our children deserve to be protected as well. I also remind parents, we talk about what's in in the vaccine, and they're very safe and effective. We also need to say what's in the water you drink, the air you breathe, the food you eat, what's in your chicken nuggets, what's in your hot dogs. And so I really think about when parents really come to us with these real serious concerns, I really want to have this conversation with them and reframe the questions and come together and realize to keep our kids safe and protected this summer, the best thing you can do for the little ones who've been left out this whole time is to go get them vaccinated.
All right. Good advice there, Dr. Jerry Abraham. What's in your chicken nuggets, by the way? Good title for a podcast. I would tune in on a weekly basis. Appreciate it.